Learning to stay within your scope of practice as a graduate registered nurse is challenging. However, it is important to remain within scope of practice at all times, as it helps to make sure that you are providing safe, patient-centered care. Today, I'd like to describe 3 realistic actions that you could take as a graduate registered nurse to ensure this. First of all, you should change behaviours. If you are uncertain that a certain task is within your scope of practice, look up the hospital policies and scope of practice for registered nurses. If you identify that you are unable to complete a certain task within your scope of practice, speak with your team leader and find out if there is another nurse on the ward or in the area that is able to complete this task for you. If this nurse has a patient load, offer to take care of their patients while they complete this task for you, or alternatively, undertake tasks that they require of you. This ensures that you are providing safe, patient-centered care, as it means that the tasks that you are unable to do are being done competently and safely. The second task that you can undertake, the second action that you can take is to make sure that you have all of the correct competencies and skills. When you first start working as a graduate registered nurse, you should create a goal list and discuss them with your clinical nurse educator. Included on this goal list, make it a priority to complete all competencies required of you as a graduate registered nurse within the first month of starting work. Ask if you can watch the clinical nurse educator and then assist them in performing the procedure, and last of all, get them to supervise you performing this task. This helps you in patient-centered care, as it means you'll be able to take these tasks do these tasks effectively in the future. The last action that you can undertake is to help lead change in the way that things are done. After you've been working as a graduate registered nurse for a few months, you should ensure that you've researched and are up to date with your scope of practice. You should continuously look out for any change in legislation or scope of practice to ensure that what you are practicing is currently up to date. Don't always rely on what your colleagues tell you is correct, as they may be wrong. This would make it unsafe for patient care. Remember, you always need to hold yourself accountable for every action that you take to provide patient safety.